This is a reminder about the bladder training that we talked about, so specifically regarding urinary urgency and frequency, basically meaning that you feel like you need to go to the restroom often and immediately. So when our bladders fill, again as a review, when our bladders fill, when they're about a third of the way full, that's usually the first alarm that goes off saying, hey, I kind of need to go. With a healthy bladder, you should be able to push the snooze button and get by pretty comfortably for about another hour before needing to really find the restroom. And so once we get to this point, so fast forward an hour later, then at this point, typically another alarm goes off saying, hey, I really need to use the restroom. And so you should, again, be able to, again, comfortably go about another hour before really needing to go. And so, not to say that you should wait until that last alarm goes off, but point being, you should, a healthy bladder, be able to postpone needing to find a restroom comfortably, certainly at least after the first alarm, be able to push the snooze button at least one time before really needing to find a restroom. And so to help build up to that, what we want to do is when you first notice the first alarm saying, hey, I need to use the restroom, and again, this is specific to bladder, so you need to pee. At that point, our goal is to try to build up in 15-minute increments. So even if it means setting an alarm, try to give yourself about 15 minutes before then voiding if you still need to void. Give yourself a full day at least of doing this. If you find that the following day it's still a challenge to postpone, to push that snooze button for 15 minutes, then that's going to be our first goalpost. So we want to comfortably be able to get to that extra 15-minute mark for at least a day or two. Once we're at that point, so again, first alarm goes off, tells your body that you need to use the restroom, that you need to pee, you push the snooze button, 15 minutes goes by, and then you're able to go about your day. Then at this point, our goal is to build up about another 5 minutes. So the next time you feel the first urge to pee, you want to try to push the snooze button for 20 minutes. So that's how we're going to gradually build up our tolerance and be able to retrain the nervous system and understand what the body feels like, what the bladder feels like when it's full enough, appropriate full enough to actually void. We don't want to train the nervous system to think that it needs to void, that the bladder needs to void when it's really only a third of the way full or not full enough to really void. Again, this breaks the habit, or basically the nervous system, from thinking that it needs to go when it really doesn't need to go, breaking the increased frequency and urinary urgency sensation.